Episode 115, Learning from Mistakes with Mark Graban. I wish I was perfect. Wouldn't it be great to simply not make any mistakes? In the practice of lean, we really try to mistake-proof our processes and build on our previous learnings to prevent mistakes. And yet, we know that we learn so much when we do make mistakes. Mark Graban has been exploring with all kinds of people how they have benefited from their mistakes. He joined me at the Ages of Lean to talk about what he's learned from those conversations and his new book, The Mistakes That Make Us. Mark Graban, welcome to the Ages of Lean.
Bella, hey, it's great to be back.
It's wonderful to have you back, Mark. And I would love for you to introduce yourself to anybody who doesn't know you. There might be one or two people who don't know you. And if you could tell us a little bit about your new book.
Yeah, well, thanks, Bella. My name's Mark Graban. I have focused on lean management, if you will, starting my career in lean manufacturing, back in the mid 90s. I'm an industrial engineer. My career took a bit of a shift, a very major shift into healthcare in 2005. I guess at the moment I wasn't sure if that was going to be a quick detour into healthcare or it's been kind of a career shift, even though I still work with organizations and other industries. But nowadays, I guess I would use labels like consultant, coach, author, speaker, podcaster. I'm fortunate to be able to do a lot of things under my own banner. I quite often subcontract through other firms. I have a longstanding relationship, part-time role with KaiNexus, a software company, for continuous improvement, so people could see the connection there. So, I've written, my name is on 6 different books, either as author, co-author on 2, an editor and contributor to 1, and I made a mistake. The new book is The Mistakes That I make mistakes all the time. The new book is The Mistakes That Make Us, Cultivating a Culture of Learning and Innovation. That's my 3rd solo book that I've written and published.
And that came out of your podcast, which which came out of another podcast. So can you tell us a little bit about that pathway? How did you get into the mistake culture world from the lean world?
Yeah. I mean, I think it's kind of interrelated and interconnected. The mistake I almost made a minute ago was referring to that podcast, which is called My Favorite Mistake.
Mm-hmm. I almost did it too. Yeah.
And there was all kinds of discussion around whether the book should have the same title or a different title. I think doing a different title for the book, I don't think that was a mistake. But so that I started that podcast, My Favorite Mistake, in first released episodes end of August 2020. It was a pandemic project. But my interest in mistakes actually goes back a lot further. So, with my working experience with lean, mistake proofing is, I think a well-known component of that methodology. So that's something I've tried to apply in manufacturing. There's a huge need for it in healthcare, opportunity to mistake proof processes that protect patients from harm. And then there's a cultural piece where mistake proofing can prevent the workers, and this would include nurses and surgeons and other frontline value-adding professionals in healthcare, to protect them from being blamed and punished for systemic mistakes. So that's been a big part of my work. The book that I mentioned that I was editor of is a book called Practicing Lean, where 15 other people wrote chapters, including Jamie Flinchbaugh, who I believe Bella.
Yeah.
Some former Toyota people or Toyota trained people. We all wrote a chapter, and the spirit of it here was to share a story, from the first year or two of your career, the early days of your own lean practice, if you will, and kind of just share, like, here's a mistake that I made. Looking back at it, I wish I had, knowing what I know now, I wish I hadn't made that mistake. But celebrating the learning and the growth, and serving as a reminder, including to myself, to be a little bit more understanding and to be kind when somebody who's new to lean makes a type of mistake that, if we're willing to remember it, that we might have made back in the day. So that book, in a way, is an exploration of mistakes and growth and learning from them, and trying to be kind to yourself and to others.
And so that started you then on that pathway. It's very interesting to me, Mark, that in order to mistake proof, you have to actually know that mistakes have been made, right?
Or at least
That
anticipate that they're possible.
yeah, or anticipate that they're possible. But I want to focus on the first aspect, which
Right.
is when mistakes get made. My experience has been in a lot of cultures that when people make mistakes, they don't talk about them. They get covered up, right?
Hmm. Hmm.
Sometimes people will cover for other people, and this is
Right.
something that I've seen a lot of, where when you kind of go through a process and you're trying to identify a rework, and you find that some of the rework in the process is somebody knows that somebody else is making a mistake earlier in the process,
Hmm.
and they don't do anything about it. They just fix
They
that
just fix it.
mistake, right?
Hmm.
So why do we not talk about the mistakes? And I think everybody sort of knows that the answer is that it's not safe to talk about
Right.
mistakes,
Right.
right? Right.
Right. Sadly.
And
Yeah.
sadly, and that comes from a lot of different places.
Hmm.
When you're working with an organization and you are you know working with leadership and with management and with supervisors, and however you separate all of those people out, how do you start that conversation with them about how what they do can actually result in rework and
Hmm.
dangerous situations? And it's about how they behave, right? It's not
Yeah.
just yeah.
Yeah. I mean, I think for that conversation to really go anywhere, to be invited to have that conversation, you've got to have leaders who, I think, already have some inkling about the role of systems, their role as leaders, and how that influences culture. Because like you're saying, Bella, a lot of the way people react to mistakes is driven by their past experiences or their fears, or of what might happen, or both. And in a lot of workplaces, it's really been demonstrated, unfortunately, that mistakes lead to punishment.
Mhm.
And I think that punishment is counterproductive. I've heard so much somebody did nothing to improve the processes or the systems or the equipment, and then you hire somebody else, and it's a matter of time before that new person makes that same mistake, perhaps. So
Right,
I,
but
but I think there's two main reasons why people don't speak up, and in the book, I cite some research from a professor, Ethan Burris. It says the two main reasons employees choose not to speak up in a workplace are, like you've already touched on, the fear factor. They're afraid, or they know they're going to be punished. The second factor I think is interesting, is what he uses the word futility. So I think of a futility factor, where I've heard people say in some workplaces, I'm not afraid to speak up. It's just not worth the effort because nothing happens, right? So this is sometimes what goes into that never-ending rework loop of, like, well, I tried getting to root cause. I
mhm.
tried looking more systemically, and I'm like, it's easier to just fix the mistakes.
Right, right, right. And that futility then I think really impacts people's engagement, right? Because if you feel that
Sure.
there's nothing you can do to improve the situation, then you're not you that will affect engagement. It's just, yeah, I'll come in, I'll do my work, and and I can't get anything fixed.
Yeah.
And
Right.
it's a what do you call it? It's not a virtuous cycle. What's the opposite of a virtuous cycle? It feeds on
Well,
itself.
you could call it a doom spiral.
A doom spiral, yeah, a death spiral, right? Right.
Yeah.
It feeds on itself. So if I feel that I cannot get something fixed, so something won't be improved, right? Then I will be less engaged, which means that I would be more likely not to necessarily take care. I may end up making more mistakes or perhaps stop fixing the mistake that I have been fixing. So it's not going it doesn't help. But the other side of it then is the people who are overall responsible for the system, if how if they feel that they cannot fix it or it's too hard or they don't have time or they don't have the money, or whatever, whatever the reason is, then they're also going to start to feel futility. I think it feeds on itself.
It does. And I think especially when, I think, leaders very often blame individuals for systemic problems. So, if there's low productivity, they might say, oh, well, the workers are lazy. If mistakes are being made, they might say the workers are careless. If people aren't speaking up, they might say, oh, the employees don't care, or that they're being cowardly. And I think that's all misdirected. And I think a lot of that is a function of culture. I've kind of come around to believe very strongly that somebody's choice to speak up or to not speak up isn't a function of courage or character. It's a function of culture. You can take the same person and put them into two different workplaces, and they will behave differently. And there's this thought experiment. I don't know if this has ever happened. Let's say somebody has been working for a very long time at the Toyota Georgetown plant in Kentucky, where the culture is one of if in doubt, pull the andon cord, and you're going to get a
Mhm.
helpful response instead of a punishment response. And let's say that's become deeply ingrained in them, and that's a function of culture, and it might be aligned with their values of like, yeah, I want to do quality work. I want, I'm a person who speaks up. And then if they had to move because of family reasons or whatever, and they were to get a job at one of the older Detroit-based automakers, I'm guessing if they went into a different culture and they out of habit pull the andon cord and they get a different response from their leaders, I bet they would learn very quickly, hey, I need this paycheck.
Right,
Message received. I'm not going to pull the andon cord here.
right. Or they look around and there's no button to press, no cord to
There
pull.
might not be a cord in
Yeah,
healthcare, and it's not even a matter of just physically, but um, conceptually, there's very rarely an andon cord in healthcare. It's any sort of process to speak up and point out a problem and ask for help and get help very quickly. That's unfortunately rare in hospitals and healthcare.
and is that exacerbated now by the the number of people who are temporary floating in and out of healthcare organizations? It seems to me that's really gone up since the pandemic. Um, and so I'm curious as to how healthcare organizations are even establishing culture anymore
Hmm,
when so many of the people
sure.
who are working there, especially nurses, are traveling, moving in and out, moving from floor to floor to deal with staffing issues.
Yeah. That's a good question. I mean, I think one of the drivers of a lot of these problems is, understaffing. And part of the reason then hospitals scramble to bring in temporary or, part-time or traveler nurses. But, again, I mean, culture exists whether we're intentionally cultivating it or not. Culture, I think, is just basically, well, yeah, how do we interact with each other? And I think if you take my thought experiment of an auto worker, I think that translates to nurses where you're new to an organization, you're going to be working there for a few months. I bet you very quickly either get told or see demonstrated what the culture is in that workplace. And again, like, that not all healthcare cultures are going to be exactly the same. There are some that are like really progressive in these ways. There
Hmm.
are some hospitals that have put in essentially an and-on cord system to great benefit. The number of reported problems goes up for a while because there's more candid reporting because the environment and the culture is allowing that. And then as you're doing problem solving, the number of harms and the bad impact starts going down. But I bet if somebody traveled and shifted from one hospital that was really good about those things, and they had built a little bit of habit of I can speak my mind and I can point out problems and I can
Hmm.
disagree with the doctors or with their nurse manager, and then they go into a new hospital again, they might learn very quickly whether they're told about the culture or they just see it or are subjected to some of those other behaviors. I mean, I think it's interesting. There's one hospital. Um, I'm blanking on the name at the moment. There are hospitals that have done a lot to reduce nurse turnover. I think that's another thing you shouldn't blame the nurses for. Like, oh,
Right.
a lot of turnover. Let's blame those nurses who are willing to jump jobs for another 50 cents an hour. Like, when people have a workplace that they really love, they're not looking to change jobs for a
Right.
small pay increase. So, I mean, I think so there are hospitals that have really focused on saying, well, we have our culture, and our culture is a strength. I interviewed, he's now retired CEO from the Hospital for Special Surgery in New York City, where they said, culture is one of their strategic advantages and differentiators. But back to your question, I mean, I think people in healthcare could create a culture, even having some travel nurses, but I think you have to, part of the onboarding, say, well, here are some of the expectations. I think the ideal state would be the expectations are you can ask questions, you can disagree, you can point out problems, you can ask for help, and that's all okay. Now, someone might not believe it instantly, but at least you're
Right.
trying to set the expectation, and then hopefully through their own experiences, they start believing it.
But yeah, I mean, and knowing that somebody coming into that situation for the first time probably would be a little trepidatious about it, if that's a word. I gotta try
Yeah.
this. I gotta step out on this ice and see if it holds me up
Well,
before I really
yeah.
believe it.
Well,
But
if I can real quick, within the context of KaiNexus, a software company, where I think, we've built, a very good culture. I've heard that directly from employees, colleagues who've come in. They're younger. They've worked at one or two other software companies before, and they can notice the difference in the culture, and that usually appealed to them during the interviewing process. And people reflect after a month or two. We've just hired some people recently, and they rave about the culture and said this is so different than where I worked before. And like there's one colleague in particular who remembered, working someplace previous where people did get blamed and yelled at for mistakes, and it took some time, to kind of put your guard down and realize, okay, if it's not, we'd say safe or safer, I can behave differently.
yeah, yeah, I can see that. That that it would take a little while, right? Because you actually develop reactions, right? If you're in an environment that is not safe, then you put up your guard, you develop certain reactions or lack of reaction in order to survive the situation, and then it would take a while. I mean, to say, okay, it's all right, I can breathe
Yeah.
here, and also I can point out problems.
Yeah.
It would be okay if I did make a mistake and maybe I
Mhm.
wouldn't be punished for it.
Right.
Yeah, yeah, yeah. So for the book came out of the podcast, and for the
Mhm.
podcast, you've interviewed over 200 people, which just amazes me. I, the number of interviews that you've done. Um, when you started the podcast, did you have the idea that you would hear the same kinds of things over and over again, or did you expect to hear different things? And what
I
actually happened?
Well, I mean, at first I wasn't even sure I could find too many people willing to talk about mistakes. Um, so the first hypothesis to test would be, could I find people that would be willing to come on and speak. We use words like candidly or vulnerably. My intent, is I tell people in advance, it's my intent is not to, to shame or mock or, attack. Like, why'd you do that? What's wrong with you? That's not the tone of the podcast at all. People share stories. We talk about the learning and the growth that came from it. Sometimes a mistake opens an unexpected door, where the mistake, was bad, but it led to something positive. I didn't really know what I was getting into there, and at least early on, I recognized, I think I trying to sort of prep and guide people that people were telling, pretty vulnerable stories, and like,
Mm,
I'm not asking people what's your biggest mistake. That's a different question. What's your
right.
what's your favorite mistake is very intentionally open-ended and subjective. Every person's going to decide favorite, for a different reason. And, I wasn't getting answers that were like a bad attempt at a job interview question. I'm like, well, what's your favorite mistake? And if people were saying things like, well, my mistake was that I worked too hard and I had it all and I was too successful and now I'm trying to smell the roses or something like that, wouldn't be very interesting. If it was sort of
Right, right.
like a humble brag kind of mistake. But I'm not getting that from people. Like I'm getting, really interesting stories and great reflections. And some of the guests are able to take a really deep dive into how they're creating, a culture of learning from mistakes, in their company. So I did start to see some patterns though, in terms of the types of answers and, yeah, and then March of 2022, I think is when I kind of put a stake in the ground and said, okay, this I'm going to do a book. And at first I thought, well, it's just be a nice collection of stories from the podcast, and that my editor kind of convinced me, well, that I had some things to say from my own experiences, lean and otherwise.
Hmm.
So the book kind of shifted and evolved a little bit, over time. And I think that made it, a better book. So there are many, many stories from the podcast guests in there, but that's not exclusively the source of those stories.
Wow, wow. I think it's really interesting when you say that there are people who have, having had a mistake that was their favorite mistake, that they have taken that and then start to build that culture into their organizations.
Mhm.
One of the things I was wondering though, as you're talking to people, I think that do you think that there are people for whom it is less safe
Mm.
to talk about mistakes, to um, you know, to admit
Mhm.
that something they did or a circumstance they were in
Yeah.
didn't go well. Um,
Yeah. I think I'm not a psychologist, I'm an engineer, but I think my understanding of trying to
yeah.
study this and talk to people, there are, as much as I talk about culture and external barriers, there can be what we might call internal barriers to
Mm,
admitting a mistake, things that might have been imprinted on us during childhood or school or, our upbringing. So there's probably, there's that variable, as well. But that's, I don't know, like socialization as opposed to courage or innate character.
right.
I think people might be taught, at different stages in life for their career that speaking up or making mistakes is going to be, punished. There are some other dynamics though where I've had some guests, and this has been helpful for me as, a middle-aged white straight man who, doesn't have the burden of, or, some guests have talked about, it's different as a woman or it's different as a person of color, where like I think like I have the privilege of, if I admit a mistake or do something wrong, I don't think it reflects on all other middle-aged
Mm-hmm.
white
Yeah.
straight men, where I have had some conversations where, if somebody is in, um, different circumstances, they may be afraid of, well, if I make a mistake, this is going to reflect badly on all the other black people in the organization or the other women. And so, that's where I try not to be dogmatic, or I certainly try not to assume that everybody else has the same privilege. And that's why I try to never frame it in terms of like, well, you should speak up or you must
Yeah.
speak up. I think that's unfair to people. It could be unfair, to other people who are, more like me. I mean, what are your thoughts on this, Bella?
Well, I just think it's really incumbent then on leadership to reflect on who they make it safe for.
Hmm.
Yeah. Is it safe for, and I remember a presentation that I saw from I think it's Zuckerberg Hospital in San Francisco,
Hmm.
where they had they brought the janitor in, right? And the they asked they were talking about cleaning rooms, and the question everyone was talking about, how clean can you get the room, and infection control was involved, and all kinds of people. um and finally somebody said, well, maybe we should talk to the people who actually clean the rooms.
Right.
Right.
That's
Right.
good lean
Well,
thinking. Yeah.
the good lean thinking, right? I mean, it's simple, but they were mostly Hispanic. Some of them, I think, I'm not sure how well they spoke English, and they
Hmm.
certainly saw themselves, I believe, much less able to speak up
Hmm.
about problems
Sure.
that they saw. And I think it's really important for leadership to be clear-eyed about, well, where are these class divisions in your organization?
Hmm.
Who is, who are the good people? Who are the people that who are not noticed? Right?
Yeah.
Um,
Yeah.
well, that I came from, there was always a big difference in people's mind between people who were in quote unquote operations, that
Hmm.
is actually getting work done, and strategists, people who thought about what work should be done or how
Yeah.
it should be done, right? And so when a strategist type person would make a suggestion, they were often listened to. When an
Hmm.
operations person was listened to, was made a suggestion, they weren't always listened to, right?
Yeah. Yeah.
Because there was, and I believe there was some idea about a difference in intellectual capacity.
Mm.
Frankly, that's what people were
Mm.
thinking. Well, if I've got a PhD or an MD, I'm way smarter than this person over here who's moving this thing along the
Yeah.
process.
Yeah.
And then, so more likely to be women, more likely to be people of color, more likely
Hmm.
to be, not not the people
Yeah.
who are usually at the top of the organization.
Yeah.
So I think it's really important at a time when DEI is sort of being, in some cases, moved out of organizations, for leaders to look and say, what in my culture makes it hard for people to speak up?
Yeah. And I think there's connections now between, lean and the Toyota production system to what you're saying there and what I'm advocating for. The notion of respect for people, that we should respect
Mm-hmm.
everybody in the workplace. People sometimes confuse educational attainment with intelligence. That's not all. Like, people in the front lines are often very smart, very creative. They know their work. They are best positioned to participate in the continuous improvement of their work. The ideals of Kaizen, of engaging everybody everywhere every day. That's not just a pipe dream. That's
Right,
very
right.
realistic and practical if leaders don't have their own mental barriers to acknowledging that, or even recognizing that it's true. But I think there's a lot of, like you said, professional privilege and hierarchy. I think the one lesson and takeaway from that, I'll bring it back to KaiNexus for a minute. Part of creating a culture is leaders leading the way. So the senior leadership team at KaiNexus, including the CEO, Greg Jacobson, as a co-founder, speaks candidly about mistakes he's made, times when he was wrong. Now, he has less to lose, right? I mean, like,
Mm-hmm.
he may feel, some sense of shame or feel like it might hurt his reputation. Actually, it doesn't. It actually helps, I think, in terms of reputation, and it helps with the culture because, let's say a CEO could get punished by a board, for admitting a
Sure.
mistake. There may be public ridicule or embarrassment for admitting a mistake, but generally people higher up in the organization have less to be fearful of externally. They might have pride and other factors internally that prevent them from speaking up. I think that's where the Toyota phrase "leading with humility," is so important. When leaders are able to lead by example, modeling those behaviors, that opens the door for their employees to follow their lead. And then when that gets rewarded by leaders instead of being punished, now you start getting into more of that virtuous cycle of
Right.
strengthening,
Right.
building, and sustaining that culture.
Yeah. Yeah. And it takes constant vigilance. It's
Yeah.
you can't you can't say, "Well, I've done it. I've done culture.
No.
Culture's over now." Yeah, we're
Well,
going to move
that's
on to
where
the next thing.
it leads to a little bit of an awkward subtitle: cultivating a culture of learning and innovation for the book, because I'm not really a gardener, I'm not a farmer, but the word cultivating seems to suggest a sort of never ending journey. You cultivate a garden, you don't implement a garden. And
Right. Oh, I love that. Yeah, you don't
you,
implement a
you,
garden.
you,
Yeah,
you don't buy culture, you don't install culture. I think you go back to the root words of culture and cultivate. There's similar origin there. But yeah, I think cultivating is a good word to use.
I love that. I love that. Yeah, yeah. Mark, I wanted to ask you about something else, something a little bit more personal, if you don't mind.
Mhm.
You shared recently, maybe several months ago, on LinkedIn that you had received a diagnosis of ADHD
Right.
as an adult, which
Hmm.
is I think quite an adventure in and of itself just to get the
Yeah.
diagnosis. And I'm very curious about that for a number of reasons. One of which is sort of the connection between ADHD and the kind of structure that a
Mm.
lean culture provides. And I would just could you start anywhere with that and tell us whatever
Sure.
you would like to tell us about that?
Yeah, I mean, I can tell you a little bit of that journey, and then maybe you can help me flesh out, what are the implications related to lean. So, like you said, and this was over a year ago, a year and a half ago, really. Um, I was struggling with some things at work. And when you say as an adult, I mean, I was 49 years old at the time. So, I think I was having some struggles at work. Things that you associate with ADHD, like attentiveness.
Mm.
And, as I kind of, studied ADHD, I agree with people that say it's a little bit misnamed. It's not attention deficit. It's more like misdirected attention, not being able to direct your attention to where you need to, or even sometimes want to direct
Because it
that
could be.
attention.
It could be hyper focus on something when
Right.
something else needs attention, right? That's
Right. Yeah. Hyper focus on the wrong thing. And then, I would there were some times this was not related to Kinexus. This was more related to another organization that I was working under their banner of, struggling with, getting upset about things, and not even like just like yelling and screaming or flying, but just, getting upset and having trouble
hmm.
letting those things go. And in a couple of cases, like, sending an email or a text that wasn't really well advised or helpful. And so, I'll share a little bit, my pathway here. So, I reached out through an EAP program that had access to talk to a counselor. I wasn't sent there to the counselor. This was
Yeah.
I pulled the andon cord on myself and said, well, let me talk to somebody about this. And, I think I'd been in denial, about some of these things for a long time. And, I think the faulty countermeasures that don't work would include saying like, well, you need to just try harder. And, and then, kind of making myself feel bad. And I think the anxiety about not paying attention just made that all worse. And so I got a diagnosis of ADHD. And from what I made a big effort to try to learn about this of like, well, it's something that's different in your brain. It's not your fault any more than somebody being type 1 diabetic. You
Oh,
would
yeah,
say that's their
left-handed,
fault,
or
or even
yeah.
type 2 diabetes. I'm not trying to say that's somebody's fault, but things you're born with, basically. Um, and that they're, the one common, thread, it seems, in ADHD, it's more a matter of like impulse control. Like, oh, okay, that impulse of what are you working on, the impulse of what are you paying attention to, the impulse of how you might react to something. So, I was trying to work on that, including, trying a medication countermeasure. And what I was told was, medication is very effective. Sometimes people still need continued counseling, especially if you've been feeling bad about this for a long time, to kind of process and talk through some of that. Um, so then coming into early 2023, like, still kind of struggling. You're trying to dial in medication and doses. I thought, well, okay. I remember they told me you might still need more counseling. So I went and found a psychologist. And so, here's where the story gets interesting. I haven't talked about this or written about it anywhere, but I don't mind sharing. Um, so there's the symptoms, if you will. There's the what they call executive function symptoms and the problem statement, if you will. It doesn't tell you exactly what the cause or the root cause is. And there's no blood test or brain scan
Mm,
for any of this, right? So she put me through a much more intensive, hours long battery of different tests and assessments. So her one takeaway was, well, the counselor that you talked to last year, like what they had you use, that was a screening tool. That really should have been the starting point for deeper evaluation that she did. So then,
oh, as,
I've learned
mm,
screening tool versus full diagnostic tool. And then, so I mean, then basically, like I think the key takeaway was she was like, these issues are, in her opinion, not caused by ADHD.
oh, interesting.
Yeah, you're hearing this for the first
Wow.
time. I
Wow.
realize we didn't prep that part of it. So stop taking that ADHD medication. I don't think it was having a great positive effect. I don't think it was having huge negative side effects. But we stopped that, and she thinks, well, there can be different causes of anxiety that manifest itself in the attentiveness issue or the way you react to things issue. So we're kind of still exploring different root
Wow.
causes and different countermeasures.
That is so interesting because I think there's a lot of conversation about that particular diagnosis right now. And I think between social media and some of the societal changes we've had
Mhm.
since COVID came,
Mhm.
that a lot of people are having trouble with focus or focusing on the
Mhm.
wrong things and anxiety.
And there's a lot
Yeah,
of things in the world kind of causing
make
increased
yeah, making
uh,
us anxious. Yeah.
anxiety. So I mean, I've tried to educate myself about ADHD, and back to your question of, I mean, I think there may be times where lean practices provide some structure
Hmm.
that could be helpful for somebody with ADHD. Deciding what do I do next? What do I need to get done today? That could be helpful.
I think, yeah, I mean, this is probably a longer conversation, but certainly some coaching that I've done with someone who does have a diagnosis of ADHD, I found that asking the question, what do you want to do next, is absolutely paralyzing.
Yeah.
That is not an easy question for someone with ADHD to
Mhm.
answer because what they see is there's a wide variety. If you ask them to test a hypothesis, there's a wide variety of ways to test a hypothesis. And now I have absolutely no idea how to pick one. So all of those
Mhm.
tools that help us narrow down and focus are potentially helpful, but
Mhm.
too much of that can also provoke anxiety.
Sure.
And I'm just really interested in, like, when we practice, lean thinking and lean tools, I do think that there is sort of a neurotypical, there is an idea of a neurotypical brain behind some of the things that we do or that we ask other people to do.
Sure.
And not
Right.
everybody's going to fit into that. I think there's more at the
Yeah.
edges of lean to explore around that and how we make a lean culture
Yeah.
available to more people.
Yeah. Because and I think the estimates are, that these differences in the ADHD brain exist in somewhere between 5 to 10% of the population. And it's just, there's a lot of people suggesting it's very underdiagnosed
Especially in
for
women.
for different reasons and different, when I was a child of, elementary school and middle school, the 1980s. I don't know how much probably then was being called ADD, how much how often that was really being diagnosed, or I don't know. Like, I talked to my mother, about this, and she was a school teacher, elementary school, through, I don't know, 20, probably up until about 10 years ago. So she was working with teaching a lot of students who were diagnosed and probably on ADHD medication. And she, I don't know, she was like, you having experienced what she experienced, she was like, I don't think you had ADHD.
Mm.
And maybe, I guess she turned out to be right. But again, like,
Who knows?
the psychologist I'm talking to is not denying that there are issues or symptoms or
Mhm.
problems. It's just a matter of trying to figure out in this, you can't do it in a very direct way. Like, one thing I think I learned about ADHD, is really the way you confirm a diagnosis is by testing the countermeasure. People who have ADHD respond well to ADHD medications. And, where people abuse, I've heard stories of, like, this is somebody whose child was in medical school. You know, this is not my firsthand experience by any means, but, believe the story of, like, how many medical school students were to help them study without a diagnosis. Or, there are people who abuse these drugs. So, again, like, maybe I'm in some, middle ground where, again, I don't think the medications had any ill effect. And to anyone who fears, like, oh, well, these things are addictive, I stopped taking the medication on the psychologist's advice, and that was not an issue. I never felt an
Good,
inkling of addiction to it. So,
good, good.
yeah.
Mark, this has been a great conversation. I have a couple more questions for you.
Okay.
The first is, um, tell us where people can find you. You're all over the place, but what's the best way for people to find you?
Um, yeah, I mean, LinkedIn is probably the social media platform where I'm most active, and people can find me there. Just, search Mark Graban. Easy enough to find online. My website is markgraban.com. The
It's
website for
easy.
the website, if, it's a Graban. It's a short name, easily misspelled, mispronounced, systemic problem there. And then the book's website is mistakesbook.com. It's available, people can find it. Most books nowadays are bought on Amazon. It's available on some other platforms, but it's available paperback, hardcover, Kindle, audiobook formats. If people want, the non-Kindle ebook version, that's available in different platforms. Audiobook can be found primarily Amazon, Audible, and Apple
It's
Books.
everywhere. It's everywhere.
Yeah.
Wow, that's great. Mark, what's your one piece of advice for a young person starting out?
Well, it's a great question, and yeah, neither of us could remember what I had said last time I was on the episode. I didn't go back to check, but, I think based on our conversation here today, um, maybe two things briefly, if I may. I know you said one. I think one is related, and I've learned this from, these people at KaiNexus who have worked at other places and then came in the KaiNexus, and, I think they've learned. And I guess thinking back, I learned the same thing. Like, when you're interviewing for a job, you need to be interviewing the company and its
Mm,
leaders as much as they are interviewing you, and be prepared to ask questions about culture. And I think some of the questions related to psychological safety and learning from mistakes, like, given the opportunity, who knows what kind of answer you would get, you could ask, Tell me about a time when an employee made a mistake and how did you and the company address that? And if the story is about blame and punishment, maybe you need to run the other direction or
Hmm.
keep interviewing.
I think that is terrific advice. That really is. Yeah,
Yeah.
yeah.
And then I
And
think
what is?
oh, I'm sorry.
Yeah, I was gonna say, what's the second one?
Okay, so I think the second one is like, if anyone is even wondering, do they perhaps have ADHD? Are they um suffering from, I don't know if that's the right, well, are they facing anxiety or depression? Is this run-of-the-mill sadness that happens to everybody, or is it something worth seeing a mental health professional, or even talking to your primary care physician, or go through your company's EAP program? I think the lesson learned is, if in doubt, talk to somebody. If you're even wondering, I think it's worth talking to a professional about it. And there's no harm in that. Hopefully, there's no shame. There's still stigma around
Mm,
these things, in a way that there wouldn't be stigma about a broken arm.
right. Yeah. Yeah. And there shouldn't be.
I agree. But
Yeah.
again, we think of like,
Yeah.
there's external societal and cultural barriers, and then there's sometimes our own internal barriers of not wanting to say something, or not wanting to ask for help.
And it's the same thing we've just been talking about, right? It's not that it's a mistake, because however you feel, that's not a mistake, but just that ability to feel that you're in a safe place, to
Mhm.
find that safe place where you can talk about what you need to talk about.
Yeah.
Yeah.
And that safe place could be, hopefully the workplace, hopefully, and more likely to be, with family and friends. Yeah.
Yeah. Wow. Mark Graban, it's such a pleasure to have you visit again to the edges
Oh,
of Lean. I appreciate your time.
well, thank you, Bella. Thank you for the questions and the, prompting. I think a discussion that as appropriate for your podcast was on the edges of Lean, but I think very well connected to Lean, I hope.
Right. All right. Thanks. This is Bella Engelbach, and I'd like to thank Mark Graban for being my guest at the Edges of Lean. What did you learn from this conversation? What ideas did it spark? What mistakes do you want to make? We would love to hear from you. You can find Mark at markgraban.com or on LinkedIn. His book's website is mistakesbook.com, and find his podcast at leancommunicators.com. Find me on LinkedIn or at leanforhumans.com, or comment wherever you watch or listen. And check out all my friends in the Lean Communicators community at leancommunicators.com, where you will find lots of great new content every week. The Ages of Lean is written and produced by Bella Engelbach with support from Podcast Inc. This is a Lean for Humans production.